today's tips for physical therapists from prosthetists. When you most likely should have your prosthetist checking a trans tibial prosthesis. Alignment. Walkers, canes, and nothing at all. All right, so imagine you have a patient that you've picked up recently because they had a health issue, balance problems, had a fall maybe, and they are back to walking on a walker after they've been great on their prosthesis. Chances are you are asking them to walk with a wider base of support to support their balance challenges, to match the safety of what they're doing inside of that walker. And that change may mean that that patient needs an alignment change to their trans tibial prosthesis because, as we discussed with lateral thrust at mid-stance, as they widen that base of support, it wouldn't be unusual for them to lose their lateral thrust at mid-stance, which is appropriate for normal human locomotion and essential to make sure the socket is loading their limb the right way. So being attentive to see if they need an alignment change that would more appropriately make sure they get some lateral thrust at mid-stance and that socket is loading the right way is important. So remember to invite your prosthetist in to do that. Next, transitioning from that walker to a cane. Now here, we're going to expect those patients to walk with a little bit narrower base of support. And with that change, again, it's an opportunity where the alignment of the prosthesis and the need for that socket to load the limb a particular way may necessitate a change. If they're coming from a walker going to a cane, narrowed base of support is likely to increase lateral thrust at mid-stance. So with that, we may need to make a change to reduce that lateral thrust at mid-stance. Remember, we want the lateral thrust at mid-stance, but we don't want it to be excessive. Finally, same thing when you're moving to nothing at all after a cane or after a walker. Base of support is going to narrow. There's going to be more weight shift onto that prosthetic side with this as well now, and you may see excessive lateral thrust. So we can do things, turning wrenches and screws, to reduce that excessive lateral thrust, make sure the socket's being loaded the right way, take good care of that patient. Now today, I would love to get some comments and feedback. Is this something you've heard before? Does the prosthetist you work with talk about this? Are they regularly checking up on their patients when these transitions happen? And if you're a prosthetist watching these, is this normal practice for your office? Are you good about teaching and training your physical therapists and other allied healthcare professionals that when there's these changes and transitions, chances are you should be involved? So I'd love to hear that down in the comments so I can find out, is this crazy and wild and strange or just a normal part of your practice? Thanks a lot. Wish you well.